So thumb-base arthritis is very common, and especially in women who turn 50. They have pain with gripping, with pinching. A lot of patients who do crocheting or weeding, they have a hard time doing that. Usually we start off with splinting. There's soft splints, and then there's hard splints that can be created by a hand therapist that's custom fit to your hand that still allows some mobility of the wrist. And then if splinting doesn't help, then we would recommend considering a steroid injection to help calm the inflammation down in the joint. Several surgeries have been discussed for this problem. The most common and time-tested procedure is using your own tissues, where we borrow a tendon from the forearm called the flexor carpi radialis tendon, and we remove the arthritic bone called the trapezium. And the tendon gets looped through the base of the thumb metacarpal, which is the big bone of the thumb. Tendon is used as a spacer. It fills in the space for where that trapezium, the bone that was removed, used to be. And people are casted for approximately 4 weeks. So the whole recovery for the immediate period is about the first 2 to 3 months. But the final healing time is 6 months to a year, and it's a great surgery, very high patient satisfaction. More than 90% of the people do great from it. Because the bone is removed, the strength is not going to be like it was when you were 20 years old. And so that's why it's not the operation for everybody, because there is a slight loss of grip strength overall. And so in the laborer, for example, that may not be the procedure of choice. They may need a fusion, whereas most women who turn age, or who are over the age of 50, who have this diagnosis, a lot of them don't really need this strength that a laborer would need. They want to crochet, they have things around the house they like to do, so they need to preserve mobility. So the nice thing about this procedure is that it preserves the mobility of the thumb and at the same time gets rid of the pain.